Autism spectrum disorder, also known as ASD. Monika, Professor Levy at Touro College, Spring 2014. What is autism spectrum disorders? It is a group of 5 disorders under the umbrella of ASD, with similar characteristics such as difficulties with communication, social interaction, and manneristic behaviors. Under the umbrella of ASD includes autistic disorder, Asperger's syndrome, child disintegrative disorder, Rett syndrome, and pervasive developmental disorder not otherwise specified. Autistic disorders is a developmental disability affecting verbal, nonverbal communication and social skills, typically appearing in the first 3 years of life. Asperger's syndrome is considered to be high-functioning children who have difficulty with social skills, motor movements, and have a restricted range of interest. Child disintegrative disorder, also known as CDD, is typically development until the age of 5 or 6, and then regression will begin. Areas of regression may be seen in expressive or receptive language, social skills, or adaptive behavior, bowel or bladder control, play and/or motor skills. Rett syndrome are children who have a lack of muscle control, delayed communication and social development, and have a stereotypic hand-wringing. This syndrome only occurs in girls. Pervasive developmental disorder, not otherwise specified, also known as PDD-NOS. It is only when children do not develop problems in communication, social skills, and behavior, or they may have mild cases, then the child will be diagnosed. Symptoms such as social challenges and communication difficulties can include difficulty in engaging the give-and-take interaction, difficulty in responding to their names, difficulty in playing social games and prefer to play alone. They fail to seek comfort or respond to parents' emotions or comfort. They have difficulty interrupt gestures and facial expressions. They have difficulty regulating emotions. They may seem immature and can lead to disruptive and physically aggressive behavior. Frustration can also result in self-injuries such as head banging, hair pulling, or self-biting. Some may speak only single words or repeat the same phrase over and over, using the ukulele. Repetitive behaviors can include hand flapping, rocking, jumping and twirling, arranging and rearranging objects, and repeating sounds, words, or phrases. Sometimes the repetitive behavior is self-stimulating. Some spend hours arranging toys in specific ways instead of using them for pretend play. It can be very upsetting for someone to disrupt the order, and any slight change can lead into outbursts. Some other characteristics can include difficulty mixing with other children, inappropriate laughing or giggling, little or no eye contact, insensitivity to pain, prefers to be alone, inappropriate attachment to objects, may not want to cuddle, not responsive to any verbal cues, using the ukulele, repeating words or phrases, and difficulty expressing needs. Parts of the brain affected by autism. The cerebral cortex is responsible for higher mental function. The basal ganglia helps regulate the automatic movement. Amygdala is responsible for all emotional responses. The corpus callosum allows communication between the two hemispheres. The hippocampus remembers new information that was just given to the child or the human. Brainstem passes the messages through different parts of the body. The cerebellum regulates, balances body movement, coordination, and the muscles used for speaking. There are no direct cause that has been established as of now. Research believes since it is a neurobiological disorder, it may have a genetic basis. Some parents believe there is a direct link to vaccination, but research evidence have shown there is no direct link. Treatment plans are usually designated to receive structured and therapeutic treatment. They are highly trained therapists and teachers that deliver that treatment plan. The therapy is guided by specific and well-defined learning objectives, and the child's progress in meeting these objectives is regularly evaluated and recorded. Intervention focuses on social skills, language, and communication, imitation, play skills, daily living, and motor skills. They provide the child with opportunities to interact with typically developing peers. These programs should involve a multidisciplinary team that includes, as needed for each individual child, a physician, a speech-language pathologist, and occupational therapist. Did you know autism now affects 1 in 88 children and 1 in 54 boys? Prevalence figures are growing every day. Autism is the fastest growing serious developmental disability in the U.S. Autism costs a family $60,000 a year on average. Boys are nearly 5 times more likely than girls to have autism.